Everyone. So the topic of my lecture is anatomy and diseases of lacrimal apparatus. So to start with, first anatomy of lacrimal apparatus. Sorry for the small fonts. Secretory system. It consists of two system: secretory system and drainage system. Secretory system of the lacrimal apparatus consists of from where the tear is secreted. It's secreted from main lacrimal gland by reflex secretion and by accessory lacrimal gland by basic secretion. And the conjunctival goblet cell by mucoprotein, Meibomian gland by lipid, and sebaceous gland for palpebral margin for lipid. Now the drainage system. It includes upper and lower puncta, lacrimal canaliculi, upper and lower lacrimal canal, common canaliculus, lacrimal sac, and nasolacrimal duct. Now this is the diagrammatic representation of our lacrimal gland apparatus. So this is secretory part, main lacrimal gland with accessory lacrimal gland in the conjunctival area. Now the drainage part consists of upper and lower puncta, upper and lower canaliculus, common canaliculus, nasolacrimal duct, and inferior valve of Hasner, from where the duct opens. So this is the diagrammatic representation of lacrimal apparatus, and this mostly come in our exam to draw the diagram of lacrimal apparatus, and it is very important topic. So lacrimal apparatus comprises main lacrimal gland, accessory lacrimal glands, and lacrimal passages, which include puncta, canaliculi, lacrimal sac, and nasolacrimal duct, as we have seen in previous diagram. So the main lacrimal gland, it consists of an upper orbital and lower palpebral part. Orbital part is larger, about size and shape of a small almond, situated in the fossa for lacrimal gland at the outer part of the orbital plate of frontal bone. It has two surfaces, superior convex and inferior concave. Now the palpebral part, it is situated upon the course of the ducts of the orbital part, from which it is separated by levator palpebrae superioris muscle. Posteriorly, it is continuous with the orbital part. Ducts of lacrimal gland, 10 to 12 ducts downward from the main gland to open in the lateral part of superior fornix. 1 or 2 ducts also open in the lateral part of inferior fornix. Accessory lacrimal glands, glands of Cross. There is the microscopic gland lying beneath the palpebral conjunctiva between the fornix and the edges of the tarsus. There are about 42 in the upper fornix and 6 to 8 in the lower fornix. Glands of Wolfram are the other types of accessory lacrimal gland. These are present near the upper border of superior tarsal plate and along the lower border of inferior tarsus. Structure, blood supply and the nerve supply. Blood supply mostly consists of main lacrimal gland and is supplied by lacrimal artery, it is ophthalmic artery. Nerve supply is sensory supply, lacrimal nerve, which is a branch of ophthalmic division of the fifth nerve, and synthetic supply is the carotid plexus of the cervical synthetic chain. Lacrimal puncta, these are two small rounded and oval opening, upper and lower lids, about 6 to 6.5 mm, temporal to the inner canthus. Lacrimal canaliculi join the puncta to the lacrimal sac. Each canaliculus has two parts. Vertical part is of 2 mm and horizontal part is from 6 to 8 mm. Right angle to each other, open separately or may join to form common canaliculus. Opens to lacrimal sac guarded by valve of Rosen-Muller. Now the lacrimal sac, it lies in the lacrimal fossa, located in the anterior part of the medial orbital wall. The lacrimal fossa is formed by the lacrimal bone and the frontal process of maxilla. It is bounded by anterior and posterior lacrimal crest, 15 mm in length and 5 to 6 mm in breadth. Nasolacrimal duct, from neck of the lacrimal sac to inferior meters of the nose, about 15 to 18 mm long, lies in bony canal formed by the maxilla and the inferior turbinate. Direction of the nasolacrimal duct is downward and backward and laterally. The valve of Hasner is present at the lower end of the duct. So this is the main anatomy of lacrimal apparatus. Now the tear film again is not a single coating. It consists of 3 layers. Outermost layer is lipid layer. 0.1 micron of thickness. The middle layer is the thickest layer of aqueous layer of 6.5 to 7.5 micron, and inner layer is mucin layer 0.02 to 0.005 membrane glycoprotein with microvilli. Mucus layer, it is the innermost and thinnest stratum of the tear film. It consists of mucin secreted by conjunctival goblet cell and glands of Mans. Aqueous layer, the bulk of tear film, intermediate layer and thickest layer. It is secreted by main and accessory lacrimal gland, comprises of water, small quantities of solids such as sodium, chloride, sugar, urea and proteins. It is alkaline and salty and contains antibacterial substances like lysozyme, beta-lysine and lactoferrin. Lipid layer, this is the outermost layer formed at the air-tear interface, secreted by meibomian, Zeiss and Morlin. It prevents the overflow of tear, retards their evaporation and lubricates the eyelids. Function of tear film, it includes keeps the cornea and conjunctiva moist. It provides oxygen to the corneal epithelium, washes away debris and noxious irritants, prevents infection due to presence of antibacterial substances, facilitates movements of the lids over the globe. Secretion of tears, accessory and basic secretion, main reflex secretion, lacrimal gland, watering, which includes hyperlacrimation, irritative sensation from the cornea and conjunctiva. Afferent pathway is by fifth now. Efferent pathway is by parasympathetic secremotor, supply of lacrimal gland, and epiphora is obstruction of outflow of normally secreted tears. Now the lacrimal pump mechanism, which is very important for lacrimal, active lacrimal pump formed by the fibers or orbicularis oculi, especially Horner's muscle. Eyelids, when eyelids close, contraction of fibers of Horner muscle occurs. Sac distension occurs. Negative pressure sucks the tear from the puncta into sac. Now when the eyelid open, relaxation of orbicularis oculi occurs, which causes sac collapse. Positive pressure forces the tear into nasolacrimal duct. Hence, the applied anatomy is atonia of the pump can cause epiphora in spite of anatomical patency. This is how opening and closing of eyelids causes drainage of here eyes are open, causing sucking of tear into the canaliculi, and when it is closed, it causes forcefully pressurizes the tear into NLD. Now the diseases of lacrimal apparatus will be continued in my next lecture. Here we have dealt with the anatomy of lacrimal apparatus and the layers of tear. Thank you.